We start with damning new details of a whistleblower lawsuit filed by the doctor who was leading the effort to find drugs and vaccines to fight the coronavirus. Stat News reporter Nick Florko is with us live. Nick, it's good to have you. This story is leading your site tonight. What can you tell us about this complaint?
Sure. So Dr. Bright, who was reassigned last month from his head as the head of the Biomedical Advanced Research and Development Authority, this government organization that works with industry to fund treatments, including for coronavirus, is alleging that he was reassigned due to longstanding clashes with his boss, Dr. Bob Kadlec. And remember, he is saying that he's a whistleblower here. So he's saying that these aren't your average spats between a boss and employee. He's saying that he repeatedly had to blow the whistle over his boss, Dr. Bob Kadlec's cozy relationship with certain companies and industry consultants. And he's laying out a number of examples that he alleges show that Kadlec directly pressured him to dole out BARDA money to some of Kadlec's favorite companies. And with that as the backdrop, Bright outlines a number of times that he clashed with Kadlec on coronavirus response that only further strained that relationship.
Let's go through some of the allegations here. Bright says he was forced to buy drugs not based on health needs, but, quote, political connections and cronyism. He said he was pressured to approve a plan to, quote, flood cities with unproven and untested doses of chloroquine. Those are drugs like hydroxychloroquine, and that is the drug, for those who don't remember, the drug that the president repeatedly touted himself until a warning that it wasn't necessarily safe, right?
Yeah, that's correct. So that's one of the most interesting parts of this complaint. As viewers may remember, Bright alleged when he was first reassigned last month that the final straw that got him transferred was his resistance to support hydroxychloroquine. And he backs that up in the complaint today. So he explains through written statements and through internal emails that a directive came down directly from HHS Secretary Alex Azar to allow widespread use of chloroquine, and that he, along with FDA's drug center chief, Janet Woodcock, worked basically around the clock for 2 days to restrict the use of the drug to only hospitalized patients.
Yeah, it's interesting. It goes on to say, quote, lack of leadership and action by HHS has placed the health and safety of all Americans at risk of not being protected from the virus, even when a vaccine becomes available. Bright also says that he tried to get the administration to scale up on N95 masks and other supplies, but that he wasn't taken seriously.
Yeah, that's correct. So Bright lays out a number of times in early January where he brought up the mask issue. There's emails actually between him and a mask manufacturer talking about this issue and him trying allegedly to get the attention of HHS leadership to take this seriously and to get more masks into the stockpile.
Can you, for our viewers, just shed light on how important Dr. Bright was to this nation's vaccine efforts if they're first hearing his name tonight for the first time?
100%. So what BARDA likes to call itself, it likes to call itself the closest thing the government has to a venture capital firm. So basically, BARDA doles out money to all the companies that are trying to develop coronavirus treatments, to tests, swabs, masks. They provide critical funding that otherwise might not be available, and they help these companies get through the FDA approval process. So they had a role in a number of the tests that got early approval. They have a hand in a lot of the most splashy vaccine work. For example, Moderna Therapeutics, they're working with them on their potential coronavirus vaccine. Dr. Bright really had his hand in almost every industry project on coronavirus. So he really is crucial.
Nick, we appreciate your reporting. Thank you for being with us. Nick Florko again with Stat News. I should also tell you there is a statement out tonight from Health and Human Services, and they say, quote, Dr. Bright was transferred to NIH to work on diagnostics testing critical to combating COVID-19, where he has been entrusted to spend upwards of $1 billion to advance that effort. We are deeply disappointed that he has not shown up to work on behalf of the American people and lead on this critical endeavor. Again, that's from a HHS spokesperson this evening.